So for the management, you still have to use the SchrDbb algorithm. So you still have to use SchrDbb algorithm for managing the disease first. When you manage birth asphyxia, is it clear? The management of birth asphyxia, you have the immediate management of birth asphyxia, which is going to be resuscitation. Is it clear? Resuscitation. And resuscitation is done by A, B, C, D. A is for the air aspiration and airway. Is it clear? Airway. So what you have to do in A here is that the first thing is that in A you have to aspirate to find if there's any suction. You can aspirate with the nasogastric tube and everything that you have. Is it clear? You have also the airway. Is it clear? That you maintain the airway by placing the child in a sniffing position, meaning that you extend a bit the neck. Is it clear? You place the child in sniffing position. Then, if the child is not continuously breathing, you have to assess for breathing by assessing for the respiratory rate. Assess for the respiratory rate of the child, and the respiratory rate is less than 40 cycles per minute. Is it clear? When the respiratory rate is less than 40 cycles per minute, in the airway also you have to start with the ambu bag. Is it clear? Ambu bag. You start with one breath. Is it clear? Now the next one is respiration. If the respiration is not favorable, we have to place now the child on a positive pressure ventilation. Is it clear? Place the child on positive pressure ventilation. Is it clear? Generally, neonates are placed at 2 liters per minute. Now, if now the circulation, the child has a heart rate of less than 40 beats per minute, you have to do a cardiopulmonary resuscitation. And how do you do a cardiopulmonary resuscitation? Cardiopulmonary resuscitation is 4 events in 2 seconds. Is it clear? You have to do 4 events in 2 seconds. You have to do what? You do 3 cardiac massage. You do 3 cardiac massage, and you do 1 breath, rescue breath. Is it clear? In 2 seconds. Is it clear? It means that for every 3 cardiac massage, 1, 2, 3 cardiac massage, you do 1 rescue breath with an ambu bag. Is it clear? That is in 2 seconds. So in 60 seconds, you're going to have 90 cardiac massage for 30 rescue breath. That's a ratio of 3:1 for cardiopulmonary resuscitation. Now, if the cardiopulmonary resuscitation doesn't work after the next, you move from one level to another after every 1 minute. If after the next minute does not work, at the level of the drugs, D is the drugs that you have to use. And for the drugs that you have to use, there are an array of drugs that you have to use. The first one is adrenaline. Is it clear? You have to use adrenaline as one drug, very important. And adrenaline is used as 0.1 milligram per kilogram. That is the dosage of adrenaline that you use. Is it clear? Per day. Now the second is going to be dexamethasone. You can use also dexamethasone. Dexamethasone is used at a dosage of 0.6 milligram per kilogram to 6 milligram per kilogram per day. Is it clear? So that's the dosage of dexamethasone. Now, and dexamethasone is very important. Adrenaline is important because it has a cardio acceleratory activity. It can increase the heart rate. Dexamethasone is important because it has a mineralocorticoid activity, so it can increase the blood pressure. Now, the next thing is that you can also give the child glucose 10% particularly, and continue glucose 5%, provided that you think that there is hypoglycemia. You can give caffeine citrate. Is it clear? The loading dose of caffeine citrate is 20 milligram per kilogram, and after 24 hours, every 24 hours, the maintenance dose is 5 milligram per kilogram. The next one after caffeine citrate, you are going to have aminophylline. Aminophylline, the loading dose of aminophylline is 5 milligram per kilogram, and the maintenance dose after every 24 hours is 1 milligram per kilogram. That is how we use aminophylline. The next one is going to be this number 6. So after that, you can also use normal saline. Is it clear? Normal saline can also be used provided the child has low blood pressure. And number 7 one, you can use naloxone provided that the mother was placed on morphinic analgesics when she was operated in cesarean section. And naloxone is an anti-morphinic. Is it clear? So those are the drugs that you can use in these patients, in patients that have birth asphyxia. Now, for prematurity, generally, so on after birth asphyxia, prematurity, we have to now continue with the other management. The other management of patients that have prematurity, birth asphyxia, and all that. The first one is going to be control of hypothermia. Is it clear? You need to control hypothermia. And how do you control hypothermia? By either placing the child on an incubator, or you place the child in KMC, kangaroo mother care. That the mother has to be, the child has to be on the chest of the mother every day for 24 hours. Is it clear? Now the second thing after that, you have to evaluate. So for after hypothermia, you have to give fluids to the child. Is it clear? Because the child can also be dehydrated. You have to give fluids to the child, and the fluids that you have to give, generally you need to know that neonates who are birth asphyxiated, the fluid is 40 to 60 milligram per kilogram for the first day. Is it clear? For the first day is 40 to 60 milligram per kilogram in the first day. And then every day you add 20 milligram per kilogram. That's a day 2 is going to be 80 milligram per kilogram. The next day 3 is going to be 100 milligram per kilogram. Now for the fluids in patients who are low birth weight, is it clear? When you are premature or low birth weight, your fluid on the first day start at 80 milligram per kilogram to 100 milligram per kilogram for the first day, because in low birth weight they don't have fats at the level of the skin in order to retain their fluid, so their fluid is easily lost via the skin. Is it clear? So that's why you have to give more fluid to these children than in children who are birth asphyxiated. Birth asphyxiated children, they don't breathe very fast, so they are going to retain their fluid, which is normally lost by breathing. While in normal children, normal neonates, the fluid is going to be 60 to 80 milligram per kilogram. If you have birth asphyxiated children, who are neonates, normal weight, it is 40 to 60 milligram per kilogram, because in this case they don't release their water via respiration. And then in the case of premature, you have to get 80 to 100 milligram per kilogram, because they easily lose their fluid via the skin. Now after the fluids, you need to know that every fluid you have to add the fluid every day. Is it clear? The next thing is to control the breastfeeding. Is it clear? You have to evaluate also for breastfeeding. Generally, in children who are birth asphyxiated or premature, the first day there is no feeding. Is it clear? When you have mild birth asphyxia, the first day there is no feeding, and prematurity, first day there is no feeding. Is it clear? If you have moderate birth asphyxia, there is no feeding for 1 to 3 days. Is it clear? And if there is severe birth asphyxia, there is no feeding for 3 to 5 days. For mild birth asphyxia, there is no feeding for the first day. Moderate birth asphyxia, no feeding for 1 to 3 days. And for severe birth asphyxia, there is no feeding for 3 to 5 days. All that is to prevent hypoxic, is going to present hypoxia and ischemia of the bowel. That is going to prevent necrotizing enterocolitis. Are you understanding? So you have to breastfeed the 20 milligram per kilogram, and you divide it based on the weight. If the weight is less than 1,500 grams, generally you give it every 2 hours. You give the feeding every 2 hours if the weight is less than 1,500 grams. Is it clear? So because they need smaller meals within a short interval of time. Why? If the weight is more than 1,500 grams, you give their meals every 3 hours, because they need larger meals and then within a larger period of time. Is it clear? So those are the elements that you have to assess in breastfeeding. So that is the next thing, breastfeeding. The fourth element is to prevent for anemia. If you want to prevent for anemia, you have folic acid that is given in this patient. You give